Hey everyone, my name is Dylan, and today is a really special day for me. I am 2 years post-op from pudendal nerve decompression surgery. It is a it is a big milestone for me, and I just wanted to give you guys an update on my medical journey. I'll try my best to be as quick as I can to summarize what I've already been through. However, for those of you who've been following me thus far, I just want to say thank you so much for all of your support. I have been on a medical journey since 2013 to try to figure out what's been wrong with me. A lot of bizarre symptoms, but I want to talk a little bit about what surgical decompression is and go from there. So on March 12th, 2020, I flew to Phoenix, Arizona to have pudendal nerve decompression surgery with Dr. Michael Hibner. Prior to flying for surgery, I tried a lot of different modalities for treatment of pudendal neuralgia. Pudendal neuralgia is pain in the distribution of the pudendal nerve. The pudendal nerve is the main nerve branch in the pelvis that supplies sensation and has autonomic function in the entire pelvis, rectal, genital, bladder, and some say the lower one third of the colon. So in 2013, I developed neuropathic pain in the distribution of the pudendal nerve on my left side. It was mostly surface area. However, I had some deep gluteal pain and I had issues with the entire nerve branch. I tried physical therapy, lifestyle modifications. I did diet changes. I ruled out a lot of different conditions with different doctors, different specialists. It was a really long journey. And while I was trying to figure out what was wrong with me, I was working a full-time job, and it was very difficult to come to terms with the fact that over time, this became more and more of my life. The nerve pain started out as like an oversensitized feeling in the distribution on the left side. It affected every aspect of my life. The majority of my symptoms were just very sensitive to touch, very sensitive to specific types of clothing. The pain then continued on and progressed to a stabbing, stinging, shooting pain all the way to my tailbone. The pudendal nerve arises from sacral nerve roots S2, S3, and S4. And over the years, I did lots of imaging to try to see if something would show up, lots of different testing for different parts of my body to see what, if anything, is contributing to this pain. I tried pudendal nerve blocks, which is basically a steroid injection, and basically for the nerve blocks, the purpose of the nerve blocks is to determine whether or not this pain is coming from the pudendal nerve. Some people get long-term relief from steroid injections, but most of the time they wear off within a day or two or a week or something like that. So for me, I tried different injections for the pudendal nerve. I tried superior hypogastric plexus, which is another nerve bundle that distributes different spots. I tried a ganglion impar block, which is more on the tailbone, to try to pinpoint where this pain was coming from. And as time went on, I realized that the neuropathic pain that I was feeling was not limited to just the pudendal nerve. I had a lot of pain, like sciatica involvement, like traveling down my leg, gluteal pain, and stuff like that. And my central nervous system became very involved in the pain. I developed what's known as complex regional pain syndrome, which usually involves swelling to some degree. However, There was a lot of central nervous system involvement. I had a lot of the neuropathic like oversensitivity on the entire left side of my body. So it would travel up to my head, my neck. Sometimes it would shoot down my arm, but mostly my lower extremities were affected, not my upper body. But as time went on, the central nervous system got very involved. It was very distracting, very hard to concentrate. I've tried a boatload of different medications to try to live with this pain. And for me personally, some medications were better than others, but really only put a small dent in the neuropathic pain. Tried, CBD. I was able to get a medicinal card for marijuana, which does help me calm my central nervous system, but really doesn't do anything for that specific nerve pain. I tried acupuncture. I've been in talk therapy. I've tried, support groups to reach out to other people experiencing this type of pain. Eventually, I graduated on to try trigger point injections for the pelvic floor. Basically, they inject your certain muscle groups near your ischial tuberosities or wherever your urogynecologist kind of determines where she's thinking the pain is coming from in terms of like the muscle. That was not really anything spectacular. And then finally I tried Botox injections to the pelvic floor. Did it through the levator ani muscles. And I will say that I do think that helped a little bit with my muscle tension. But unfortunately, pelvic floor Botox only lasts for a couple months and then the Botox wears off. And when the Botox wore off for me, my symptoms got even worse. So to me, that tells me that did do something, but it wasn't the end all be all. So I made the very difficult decision to have pudendal nerve decompression surgery with Dr. Hibner. In the USA, I believe that he is one of the better surgeons for pudendal neuralgia. There are a lot of different surgical options in terms of their method to try to get to the nerve. However, transgluteal surgery is the most invasive way. And so basically, the sacrotuberous ligament is cut through the gluteus, and the nerve is followed all the way down to Ayclock Canal, which then it branches off. And the sacrospinous ligament is severed and left severed. And a lot of the distribution of the nerve is cleared of scar tissue. And I believe that a lot of the nerve branch can be decompressed in this manner. Now, there are other methods of surgery. They do laparoscopic surgery. Transischiorectal is another methodology for the surgery. There are not too many options in the United States. I know there are a handful of other doctors that do the surgery. However, I chose Dr. Hibner because he has, in my opinion, the most experience on this nerve branch. He went over to France to do decompression surgeries, which is where they developed the decompression surgery. Pudendal neuralgia and pudendal nerve entrapment is very common in cyclists who are constantly sitting on a bike seat, and that nerve is being shaken around and pushed and pulled in unnatural ways for a long time. So I made the decision to travel to Phoenix, Arizona 2 years ago to do the surgery. I traveled with my mom and dad. My parents have been monumentally supportive in this endeavor. Without them, I would not be where I am today in terms of health and the knowledge that I have. So obviously, shout out to my parents. They traveled with me to Phoenix, Arizona. And on March 12th, I had my surgery. And that was also the day that the United States started lockdowns for coronavirus. My doctor said that my mom might be kicked out of the hospital room, and she said over my dead body. So definitely not the best timing, but I was the last surgery that my doctor had performed until quite a long time after that. Um, During that time, my doctor was also in the process of opening his own practice, not through Dignity Hospital in Phoenix, Arizona. So it was a little bit scary not being able to get a hold of him for several months after the surgery. However, I did have, virtual visits with him when I was able to. So now that I'm 10 minutes into my video, I apologize for the very lengthy description of what I've tried. The $1,000,000 question that I keep getting asked by people is, did the surgery work? And I have been asked this question for, hundreds of times over the last 2 years. And the answer to that question is yes and no. So the first year of surgery was worse than pre-op. I thought that this nerve was damaged. There's no way it's going to be fixed. It's even worse, blah, blah, blah. However, going into year 2, I did notice that there were times that the nerve pain backed off. So there is good news, but it is a long, long, long recovery. It can take between 2 and 3 years to really tell if the surgery was helpful or not. Your central nervous system is going to completely freak out. Anytime you mess with any nerve that is involved in the autonomic nervous system, so the autonomic nervous system is the part of your nervous system that controls the things that you do not consciously think of, like your breathing, your digestion, your keeping your pelvic floor closed so that you don't leak out pee and poop all the time. So that pudendal nerve was trapped for 7 years in my body. So if you think of carpal tunnel syndrome in the wrist, they go in and they surgically fix that nerve. That was what was going on in my pelvis. So with that long of time that nerve was surrounded by scar tissue and was not able to heal or function the way it was supposed to, going in, cutting open the pelvic floor and basically clearing out that scar tissue, your central nervous system is going to think that there is something wrong, So expect to have a very, very long recovery for this surgery. Do not leave yourself with 0 options after surgery. So there is a couple of things that I did not try for my pudendal nerve prior to surgery, and that would be a spinal cord stimulator. So this is a device that they implant surgically, and it has leads, and those leads attach somewhere on your spine to send a low frequency signal to your spinal cord, telling your nervous system, hey, we are going to send the proper signals and we are not going to misinterpret pain signals 24/7. So that is something that I didn't try prior to decompression surgery. The other thing that I didn't try prior to decompression surgery is there are 2 things called cryoablation and pulse radio frequency ablation. So this is basically destroying nerve tissue either through heat or through cold. These are things that some people with back pain do try on specific nerves. So I left myself with choices if this surgery did not work after surgery. Do not leave yourself with nothing. That is my advice. The other piece of advice that I will give people who are considering this surgery is to, second and third piece of advice is to make sure you have a financial and emotional support system. After surgery, you are going to be miserable. You're not going to want to go on. You are probably not going to be able to live the life that you did prior to surgery. You are going to not want to work full time. Your energy is going to be depleted from being in so much pain. Financially, you're going to need to have a support system. So either disability or family members or friends or something. Do not leave yourself with nothing. Third piece of advice is to think outside of the box when it comes to pain. So this is where I segue into Ehlers-Danlos syndrome. For years on end, I did not have the vocabulary to describe what was happening to me. As a child, I had all of these suspicious symptoms, and people just normalize, oh, it's just normal, you just have anxiety and whatever. And there were so many little things that I could not put together that involved different body systems. So thirdly, my third piece of advice is check out genetic testing. Think about rare disorders. There is no reason that someone's nerve should become entrapped without a direct injury to the nerve. And that's exactly what happened to me. My nerve became entrapped with something that should not have injured me. And this is where I come into Ehlers-Danlos syndrome. Ehlers-Danlos syndrome is a connective tissue disorder. There's 13 different types. Some people say there's 14 different types. Many of the types of Ehlers-Danlos syndrome have a genetic test that you can take to determine if you have or have these types. But the most common type of Ehlers-Danlos syndrome does not have a genetic test. And it is a spectrum disorder. That means that some people have very severe symptoms. They are hospitalized. They cannot live day to day. They sometimes can't walk. They can't do normal things. And other people have minor annoying symptoms that they don't necessarily think is anything major. And they may have periods of time where they have flare-ups and then other times where they're fine. But on the outside, these people look normal. There's a lot of skin symptoms. There's the most obvious type. The most obvious symptom is joint dislocations, which I did not have. I never have dislocated a joint. So this is why Ehlers-Danlos syndrome wasn't really, looked at for me. But outside of the realm of connective tissue, rule out other disorders that cause pain. Whether or not you think it has to do with the pelvis. It might not have anything to do with the pelvis, but rule it out. If you are on your journey to figuring out why you are in pain or why you have neuropathic pain or something like that, look at genetic testing. Get tested for rare disorders. Doctors are never going to order these tests unless you advocate for yourself and you do your own research. Check out things like multiple sclerosis, check out Lyme disease, check out lupus. There are so many other disorders out there, more common, I'm not saying they're all rare, that may not have directly to do with the pelvis that may be contributing to why you're feeling neuropathic pain. So that is my advice for people who are considering having, why they're having pudendal nerve pain. Obviously, pelvic floor therapy, physical therapy is monumental in maintaining a quality of life. I would not be where I am today without the physical therapists I've had over the years. The physical therapists I had were the ones that told me, hey, I think you have a connective tissue disorder. You fit kind of the presentation of somebody who has a connective tissue disorder. And I never would have explored that option had it not been for the physical therapists in my life. So shout out to those women. I know you know who you are, over the years. And then the other piece of this puzzle that I found out after decompression surgery was that I have vascular compression syndromes. Vascular compression syndromes, the most common one that people know is pelvic congestion syndrome. This involves the blood vessels. Your body is not getting blood flow where it needs to go. Blood vessels are part of the autonomic nervous system. So any dysfunction going on with your autonomic nervous system is going to affect your blood vessels. I went to have a venogram with intravascular ultrasound done in October of 2020. Something told me that there was something else going on with me outside of my nerve issue that I needed to get checked out, and I had vascular surgeons take a look at my imaging prior to surgery, and they all agreed that I had evidence of vascular compressions even prior to surgery, which would have been something that I would have wanted to rule out prior to surgery, but what are you going to do? That's why it is super important to research for yourself, even if you're with a specialist, they only know like 20 or 30 disorders. They don't know anything. They don't know what they don't know. So unfortunately, you think that just because you're with a specialist, they would have brought things up or whatever, but that may not always be the case. I am continuing to learn about myself. I am continuing to research different contributors to my pain. The most important thing that I think I have done is going the genetics route after surgery. So thank you for tuning in. This video has become entirely too long. I do have more to say, but I think I'm going to post a separate video to speak about my genetics discoveries. I have been diving into whole genome sequencing, and I have found out a lot more things that I wish I had known from day one. But when it comes to pudendal decompression surgery, I would say 2 years from now, I think it was a successful surgery. And the way that they define success is any positive change in the nerve pain. Even if it's a small amount, any positive change is considered success. So I do still have flare-ups of the pudendal nerve. I still have stinging, stabbing pain. I still have issues driving. Driving in the car is one of the most uncomfortable things for me because I am, number one, sitting, which is very bad for pudendal nerve pain, and number two, I am in a vibrating car that any like, you know, vibration on my tailbone, it hurts. So I'm really not able to drive a whole lot. I still do drive here and there, but most of the time I choose not to drive. It's very painful. So in terms of pudendal nerve pain, improvements. However, other symptoms that I had prior to surgery have gotten worse, but those symptoms are contributed or related to Ehlers-Danlos syndrome and not pudendal neuralgia. So I want to send out my love and support to anyone who is considering pudendal nerve decompression surgery and say that do whatever you can prior to surgery to rule things out and prepare financially, emotionally. Hang in there. If you've had decompression surgery and you're not experiencing the results that you thought, or you're still in excruciating pain, hang in there. Like I said, the first year of surgery, I thought that was it. There was no recovering, you know, no turning back. But on year 2, I can say that overall my nerve pain is better. I still have a really long way to go. I am still fighting for disability because my quality of life is not where it was prior to surgery. Even before that, my quality of life was changing. So I'm trying to advocate for myself and listen to your body. Listen to your body. Your body is going to tell you stop, rest, do what you can for yourself. Thank you for watching this insanely long video. If you have any questions for me, feel free to reach out to me. I have changed my username. My new username is called An Orange Zebra. You can find me on Instagram, on YouTube, on TikTok. Reach out to me, DM me with questions. I'd be happy to answer. And again, thank you all for the love and support. And here's to 2 years post-op, and keep going and keep fighting.